Friends, good evening. It's an epoch-making evening today on a Friday evening when I've been gifted with an amazing panel, which actually would lay the path towards activities that we have taken over in a very strong way in the last 7 months. While we look forward to you all in the audience to be live wire audience, that means you can put your questions and comments live to the four panelists that I'll be transmitting on your behalf to a very learned kind of a panelist, which actually would help us out in all aspects. I would also like you to interact and leave your comments. This happens to be a path-breaking kind of an attempt that IPCA Life Sciences has taken forward. I, Sanjay Pandey, sit at the office at Kokilaben Hospital, having just completed a telemedicine consult, and look forward to learning from the stalwarts how can we polish ourselves and get better. Friends, we are actually thrilled to have a kind of a panelist who need no introduction. But for the sake of warming up the whole game and taking it forward to the highest possible level, I'll all of you switch on and get to an evening coffee. I would start with naming my panelists because they all will be to you live on the question hour all the time. My friend Ketan Shukla from Ahmedabad happens to be a consultant urologist and a transplant surgeon at the ROGIM Specialty Hospital. He happens to be Associate Professor of Urology and Transplantation and Head of the Urology and Transplantation 3 at the famous IKDRC in Ahmedabad. With 22 years of practice deeply into urology, having been decorated with this wonderful Sai Ratna Award for his services to the society in Maharashtra, been a part of these 400 kidney transplants, and the person involved in the domino kidney transplant operation has actually taken up urology to different heights, being into this kind of a practice, which he has now taken forward from an offline to an online consult. I had a small chat with him today morning, asking him that, how does it look like? And he said, I'm bubbling with a combination of both because unlocking is happening around and he's taking it forward to the highest possible level. Dr. Ketan, welcome to the show.
Thank you.
Thank you so much for joining, Dr. Ketan. Dr. Rajiv TP needs no introduction, but happens to be a mentor to me in so many ways. I call him at odd times and odd hours on one of the busiest phones in the country at this point in time. Dr. Rajiv TP is Honorable Secretary of the Urology Society of India, and under his leadership, I think we all have moved urology in this country to the next level, accelerating our academic standards right from new leaders and looking at all that we can do. Rajiv TP happens to be the Professor and Head of Department of Urology at the Guwahati Medical College, and he has been Honorary Secretary of Urology Society of India in the East Zone when I was an invited delegate there. His expertise in all these did start from the gold medal at the All India Institute of Medical Sciences, and he has taken research and activity and hand-holding many colleagues to a different level altogether. Rajiv TP, you are one of the busiest right now, hand-holding academics to the best possible level. We are proud of you. Thank you for sparing time and joining us on this amazing platform that you agreed to come in. Thank you. Welcome, sir. Rajiv TP, are you there? Are you unmuted?
I'm
Good
there.
evening. So nice.
Good evening.
So nice. So nice. Thank you so much. While I let everybody warm up, I would then welcome a guest who is known in this country for so many reasons, for the proficiency that he has. Advocate Mahinder Kumar Bajpai, welcome to the panel of urologists. Thank you so much for being there, Advocate. Advocate Mahinder Bajpai is a leading authority on medical laws and is a practicing counsel of the Supreme Court. He happens to be the honorary director of this very famous Institute of Medicine and Law. We all have been reading that monthly law report on medical law cases, which is transferred to us. That happens to be one of the most amazing kind of collection and collation of the biggest organized database of medical laws in the country. Dr. Bajpai, you happen to be the author of the Law of Criminal Liability and Medical Negligence, which happens to be one of its kind of a published work in the country. You having been known as a reputed speaker and a commanding respect on both the legal and the medical fraternity together, it's great to have you here for the extraordinary ability that you have in terms of complex legal dictums. And you're going to open up and make us comfortable on the legal dictum of this telemedicine law, which came up in the month of March. Bajpai Sahab, welcome to the show. To me, it's a great and a proud moment. Professor Sunil Shroff, I joined you in 2000 July as associate professor in your department, as an inline worker, and probably enjoyed working for 10 years as an inline, and then I probably joined you offline when I came to Mumbai. Professor Sunil Shroff happens to be a senior consultant urologist and kidney transplant surgeon at the Madras Medical Mission at this point in time, and erstwhile head of department, steered so many major boys who actually become urologists in the country worldwide, a social entrepreneur by being heavily instrumental to me and to the country in establishing this diseased donor transplant program in the country. To me, the chief editor of the largest health website, which I've been surfing every morning, the medindia.net, which I recommend everybody need to get inside and probably polish ourselves. MedIndia being ranked one in India and South Asia happens to be one of those which has been actually looked at more than 2 million users. Professor Shroff, your prowess in the medical field and urology has been known to us. You have put your lifetime into this. I can just see behind you on your right side is that very important decoration that you did everybody proud by being at the Kaun Banega Crorepati as an invited Karamveer by none other than Mr. Amitabh Bachchan to take this important subject finally to every home and every bedroom in the 9 to 11 Sony television. Dr. Shroff, you also have started this important aspect of training, practicing telemedicine certificate course since April. While the Medical Council of India has agreed to bring this course in 3 years' time, you already took it to the highest possible level, right from urologists to other medical faculties. Professor Shroff, welcome to the show. Thank you so much for sparing your time. Without much ado, I gather at this point in time that we have got colleagues already joined in. I know you all have a cup of coffee in your hand. As I look at the larger picture of people having joined and questions already coming in. So for the audience, before I come back to you in some time, as we take off on this important show, I gather you all happen to be live audience. Your questions are welcome here. As I start with my colleague, Ketan. Ketan, I would refer to you as friend Ketan. Ketan, you took up this important challenge in the city of Ahmedabad. You took up this telemedicine consult at a point in time when everything was closed and locked down. The patient decided to come back on a follow-up consult, on a first consult. Patients who had a pause in consult and then came back to you because they wanted you back. Ketan, can you take us in a very crisp idea about what did make you get into this? Were you forced to take it up, or was it a part of your passion that you always wanted to do it at the Arogyam Specialty Center?
Good evening. Thank you very much. The telemedicine was the concept is since many years. Means we were into the telemedicine since so many years, and it was not a new thing when the corona came. Means it was already there. We were using it for many different purposes. Like we were using it for our mobile lithotripsy van, where it is going and we were seeing the images, pre-lithotripsy, post-lithotripsy images, and we were consulting with the surgeons. That was going on. Patients, they were taking advice on telephone and sometimes on WhatsApp. It was also there. But the actual advantage was seen in the lockdown period, when the patients were afraid to come to the hospital and they were having trouble. They were having urine tract infections. They were having small problems, fever or whatsoever, pain because of stone. So all those things, for those minor problems, we were doing telemedicines regularly, almost 10 cases per day. It was so common at that time. And so it was not a new thing. But what was the most important thing, that patients started believing in telemedicines. Right now, even though they are in Ahmedabad, they can come. But if they are allowed or given opportunity, they would like to do follow-up consultations. They would show the reports once we have advised certain reports, and then advise and talk on the telephone is much easier. And now with the technology, using the video calls and video conferencing, we can cater even their relatives also who are in the office also. The father is at home, son is in the office, still we can communicate with each other. Those type of advantage we could see in the post-corona area period.
Got it, Ketan. Ketan, so it almost looks like that as a urologist, you and my colleague urologist had already slipped in from what was not so theoretical approach that we already had. We had an approach to telemedicine already. We possibly were guided by rough estimates and by our acts and probably a patient-doctor relationship, and we were doing quite well. The laws actually came up and probably we got more guided. But I will now move from here and go to Professor Shroff. Dr. Shroff, you happen to be a visionary because I've seen your slides in 2000, 2001, when you're talking about telemedicine is possible for India. And at that time, we were in infancy talking about what are you talking about? Star Wars at that point in time. So since those days in 2000 to 2020, 20 years, I've seen you moving on telemedicine, step by step to reach that pinnacle where you are in right now. Could you give us your opening comments on the evolution of telemedicine to where it has been, and then I'll come to the experiences.
So, Ketan, thank you very much for the opening remarks on telemedicine, and I'm so happy to hear that you believe in something called telemedicine. And telemedicine, is nothing but healing at a distance, very simply. And it's amazing to see how we have used technology to help our patients. Evolution of telemedicine in India has been very interesting. I think we owe a lot to ISRO, Indian Space Research Organization, by putting all those dishes out there and helping us with telemedicine consultation, especially for remote locations, be it Andaman Nicobar or the Himalayas, or be it the Kumbh Mela. So I think, the foundation for telemedicine in India was laid by the Indian Space Research Organization. And although we have been doing telemedicine for almost 20 years in India or even more, the problem was we didn't have a framework for telemedicine. And on the 14th of May, telemedicine guidelines were passed by Government of India soon after the disaster was kind of announced. After the Disaster Act, in fact, I think the Disaster Act was announced on 23rd of March, I think. And on 25th of March, we had the TPD or Telemedicine Practice Guidelines from the National Board Council or the MCI Super Session. And on 14th of May, those guidelines were notified by the Government of India, which means no going back. So today we have a legal framework to practice ethical and safe telemedicine. And what it involves is that every RMP or registered medical practitioner will need to take an examination within 3 years of these guidelines to make sure that they're familiar with these guidelines. And every new graduate in our country will have to pass the test. And so what happens is in their graduation, when they get to council, when they get certification to practice, telemedicine will be included as part of practice. So with the vision of our government, with the vision of Narendra Modi to have the electronic health centers, the EPHCs, electronic, PSCs. So we are hoping, and with this, with the health insurance scheme coming in to cover people, 40 million people, who are below the poverty line, I think this will grow and grow and grow. So I would request all my urology colleagues in the audience today to go and get familiar with the guidelines. This is about 44-page document. Get familiar with the guidelines and practice safe and ethical telemedicine.
Wonderful. Wonderful, sir. So those were very important opening comments I was always waiting for. We heard something from you, sir, and I just want to put it in very small perspective. You did talk about E and the word E. You talked about electronic. You talked about ethics and ethical. You talked about the evidence. You talked about the evolution. You talked about E for experience. You also talked about E for expectations of both the patients and doctor. And finally talked about editing and taking it forward. That was great. I enjoyed this, sir. Thank you so much for those opening comments. When I come to Dr. Rajiv TP, sir, that you have taken Urology Society of India to a different level all through this year 2020 from January Kochi till now. Tell us how USI is taking this important aspect of guiding urologists, which Dr. Shroff did usher in. His closing sentence was, I would enhance everybody and empower every urologist to look at practicing telemedicine. So, sir, from the very important framework of Urology Society of India's office that you occupied, would you tell us that how would you look at and how would the Urology Society of India look at helping urologists doing a telemedicine practice, imbibing the guidelines which has been got up by MCI?
So first of all, to start with, I could say that pre-2020, before we had the Kochi UCCon, the telemedicine was hardly there in the picture. And even there were some rules and regulations against if you pass on some prescription through WhatsApp or other things, it was penalized. There were rules. But in the current era of the ongoing pandemic, where safe distancing is a norm, we as clinicians will have to take the challenge of addressing these issues, thereby reducing patient overcrowding in the hospital. This is one way where we can reduce the patient overcrowding in the hospital by taking telemedicine OPDs. The branch of telemedicine offers at the moment, the best way of solving these issues, where the patient can see medical help from the comfort of their homes, because you can see that there are certain patients who are quite far off, where they need help. Because of the ensuing problem, they cannot approach the hospital. So if each and every hospital have got a facility of telemedicine OPD, and each hospital, I think, can enroll doctors having for this an earmark for this telemedicine OPD. Then telemedicine guidelines have been laid down by USI. I think Dr. Shroff was a lead in this thing, and we in fact had one of the first webinars of Urological Society of India was on telemedicine, and wherein Dr. Shroff was the lead there. And these telemedicine guidelines have been laid out by USI in order to assist the urological practitioner in pursuing a sound course of action to provide an effective and very safe medical care on current available resources and the patient's care, while ensuring both the safety of the patient as well as the safety of the physician. And with, as Dr. Shroff has highlighted, these telemedicine guidelines have been accepted, passed by the government, published in the Gazette. So now, even if we have a telemedicine OPD, it is within the frameworks of all the legal rules. So it is another option wherein people who cannot come from distant places, where they need, where we can have, give our opinions on telemedicine, and those people who need special care can be asked to come over to it. So even though this has been started because of this pandemic, this telemedicine is going to stay in the future to come. This is my view on behalf of the Urological Society of India.
Thank you so much, Rajiv sir. So it looks like with you both being around, you and Professor Shroff, it looks like we are looking at, getting enthused on the urological side, but we have somebody who actually would not make it only interesting, but make it very practical for all of us as laymen. We happen to be doctors, we happen to be laymen when it comes to real laws. And we have got an authority on this legality, right, from the practicing counsel of the Supreme Court, Mahendra Bajpayee Saab. Sir, coming to you, Bajpayee Saab, your opening comments on two important aspects, which my colleagues did talk about in terms of telemedicine was possibly in the past only that much because we were on the fence for umpteen reasons. And now that we have got everything, which is as a written code of conduct, would you take us through that journey on the month of March, April, early March, late March kind of thing, when the legal developments actually coincided with pandemic? Not that the pandemic came in and we got in, but the legal developments coincided with pandemic and ushered in a new era to allopaths more so, and here to specialized urologists, as to how these legal developments took us forward and we got enthused and we are right now on the platform of telemedicine. Bajpayee Saab, for you.
Thank you, Dr. Sanjay. Let me share a very interesting fact. Exactly 20 years back, on 24th March 2000, President Bill Clinton, he had inaugurated the first telehealth facility in India. Dr. Shroff has shared rightly that ISRO had given the infrastructure, the know-how. So amongst the developed countries, we were the pioneers. Unfortunately, what happened was there were no laws in place. There were no guidelines. There were confusing judgments coming right from the Supreme Court to the Bombay High Court, whether that is telemedicine is acceptable, not acceptable, what should be done, what should not be done. Now, this is as far as doctors are concerned. As far as entrepreneurs are concerned, who will put money in telemedicine when we don't know which way it is going to go? So we lagged behind 20 years. Nevertheless, thanks to this pandemic, we have got these telemedicine guidelines. In fact, we lawyers always fear a space, a domain where you don't have specialized law, because there all the laws are applicable. Now, at least we are absolutely sure that as far as telemedicine practice is concerned, whatever has been covered in these guidelines, It is only these guidelines that would be applicable. Nothing beyond that. So for doctors, yes, please look into the telemedicine guidelines. Whatever has been said, that is ipsissima verba. Divine revelation, follow it. Even the Supreme Court cannot go beyond that. Because it is the written law, it is the statutory law, everyone is bound to follow it. One wrong notion that most of the doctors carry, and I'm not very sure about urologists, is that, okay, now these telemedicine guidelines have come, then I should be on an app or on a platform. Sorry. It is regulating even a simple phone call that your patient is making to you. It is regulating a SMS message that you are sending to your patient. Apps and platforms obviously are getting regulated. But yes, any digital communication you want to have with your patient, look into these guidelines, know them perfectly, and then go ahead. You need not bother about law. Third aspect, I beg to differ with Dr. Shroff. It is not that within 3 years you have to do a course. The guidelines say that as and when Medical Council of India comes with a course, within 3 years of that course coming into existence, all the doctors who wish to practice telemedicine, they will have to do this course. Now the Medical Council is gone, the National Medical Commission has come. Obviously, some more time will be taken. Till the time course comes and 3 years thereafter, you have all the liberties to practice telemedicine without doing that course. But yes, after that 3 years period, you will have to do the telemedicine course, and then only you can practice telemedicine. That is all, Dr. Sanjay.
Yeah. Thanks, sir. So it looks like that while we as allopaths or as urologists have guiding principles, moral values, professional conduct that we continue to follow in our practices regularly, we're also looking at, we already have our own guidelines. As urologists, we heard our secretary talk about the existing guidelines have been reframed, India-centric. We have standards of care, we have our protocols, we have our policies, and we have got guidelines from other countries too. So we have already moved on the path of gentle co-activity where we have taken it to the highest possible level. But when it comes to Vajpayee Saab, coming back to you, looking at the laws that have been framed or the legality which has been brought around, the question to you, Vajpayee Saab, will be, there was what Dr. Ketan did allude to in the era of WhatsApp, in the era of asynchronous teleconsult, where an email would be sent in the morning, I would see in the afternoon, I would then probably answer at that in the evening. That was an asynchronous consult of non-chats, which was SMSs and emails. Coming to a synchronous consult right now, that means the guidelines have actually brought in a face-to-face talk like the one happening right now, where a patient gets into the activity around. Would you help us a little bit about the guidelines talking about the modes of teleconsult allowed in both synchronous and asynchronous under the laws right now, for my colleagues to really pick it up to the best possible ways? Vajpayee Saab.
Allowed, without any ifs and buts. Asynchronous, synchronous. All the known modes of communication are permitted. Video, audio, text. You can use them. Absolutely no fetters.
Thank you. So we have got video, we have got audio, we have got chat-based consults, which we look at and possibly can make changes as required. We also continue to have the asynchronous email, the fax, and those things which come along, and we take it forward. That's great. Vajpayee Saab, I'll continue with you for a while, because then I'm going to come to Ketan and ask him about his aspect of taking up these guidelines in a way. Vajpayee Saab, would you tell us about this very legal words or the new words added to telemedicine armamentarium called the first consult, the follow-up consult, and a possible pause in consult?
Dr. Pandey, whom have you put this question?
To you, sir. Vajpayee Saab, Mahendra Vajpayee Saab, to you.
Okay. You said Ketan, so...
No. I'll come to Ketan and ask him the same one, but go ahead, sir.
I'm sorry.
The first consult...
Look, I got it. If you look at the
Can I just
they give
make a comment?
great importance. Yeah, please.
Professor Shroff, yeah, you can just raise your hand. I'll invite you back.
So, I just want to tell Dr. Mr. Bajpayee that, the telemedicine guidelines, actually, if I may share my screen to show you, it says actually, I don't know how it is interpreted, within 3 years of notification of telemedicine guidelines, a course should be taken. It doesn't say after MCI has released it. May I just share my screen so that we are very clear on this point? And it's very important for all practitioners to be familiar, because I don't want to let them go wrong and do something stupid and the whole ecosystem will fall down. So I just want to show these guidelines very clearly so that we are very clear. Can you, on this, let me just share my screen.
Go ahead, please.
Can you see my screen?
Yeah, we can.
1.3, registered medical practitioners are entitled to practice telemedicine. All of them will take online course to practice telemedicine. To enable RMP will want to practice telemedicine, get familiar with these guidelines as and where process of limitation of telemedicine practice. An online program will be developed, made to Board of Governors. All registered medical practitioners intending to provide online consultation need to complete mandatory course within 3 years of this notification, office notification. So our interpretation of this is that take it, because courses are available now. Don't wait. The only reason I'm saying this again, Vajpayee, is not I'm not trying to counter you, but only I'm worried about people practicing telemedicine without actually going through the course, without actually going through the guidelines. Guidelines. There are some things given to the RMP, a lot of power, but that power has to be used with discretion. And that's what I want to emphasize on this again and again, that don't do something stupid and let the whole, what will happen, there'll be immediate action, get into trouble, it'll be reported in the press as it happened very recently. I can show you those clippings also. So practice it prudently. Telemedicine doesn't give you a solution for everything, but it's a good instrument. This guidelines are a good instrument for you to practice safe telemedicine. That's all. Sorry, Baptiji, I'm not countering you. I just want my colleagues to be safe. That's all.
Completely fine, sir. Thank you so much. Thank you so much for taking us forward. So this is all about we still balancing and learning. Bajpayee sir, coming to the first consult, the follow-up consult, and pause in consult, which are practical domains.
Dr. Shroff, if you read that provision, 1.3.3, it is saying it is not talking about notification of the telemedicine practice guidelines. It is talking about notification of that course. In fact, MCI had appointed a committee. I don't know what will happen to that committee.
I'm aware of that. It's by
So after 3 years, once that course is notified, it is available. From that day onwards, 3 years.
Okay,
is the time which has been given to get that course.
The only idea was to, I want to put this in their mind that please read the guidelines.
That's absolutely. They absolutely. So guidelines are applicable.
Clear on this, and let's move forward. Yeah.
Go ahead, Bajpayee sir. Go ahead with your answer.
Okay. So the professional discretion of the doctor has been given paramount importance in this guidelines. And the only fetter that has been put is on prescribing medicines. What is the logic behind it? I am still not very clear. In fact, if you ask me, if I was there in their place, I would not have put this. Professional discretion, it's professional discretion. But they have put fetters. And the fetters are, they have prescribed 4 lists of medicines. And they have also laid down what medicine can be prescribed when. And only for the purpose of prescribing medicine, they have brought in the concept of first consult, follow-up consult, pause in consult. In fact, I always, in these webinars, I have been saying that you doctors were speaking amongst yourselves. This is a first consult, it is a follow-up consult. But in the written law of India, for the first time, this concept has come inside. Earlier, there was nothing like this in the written law. Now, what is this first consult? Very simple. Patient has come to you for the first time, or the patient has come after 6 months of the first consult. So probably you don't remember what was his ailment, what is it that you have given. So now you give him safe medicines. Otherwise, that patient has to be considered as a follow-up consult if he comes within 6 months and he happens to be an old patient. This pause in consult, though it has not been stated very explicitly, but this concept is also there. Pause in consult. So what it means is, you have started, a patient comes to you, it's a first consult, he has come first time, a new patient, you have accepted him. And then you ask him, no, I think you have diabetes, why don't you consult a consulting physician, get me a report? Fair. Or you ask him to get some investigations done. Now in the interim period, when he comes again for the second consultation, please don't treat him as a follow-up consult. If the earlier consult was a first consult, the next one will also be a first consult. If there was just a pause in between, consider that as pause. One more clarification. This pause in consult has nothing to do with your charging of fees. Rather than people asking question, let me put it out rightly. You can charge your fees for that first consult before pause. You can charge fees for that first consult after pause. You have all the rights. Just disclose them. What is the mode in which you are going to charge the fees? Your terms and condition, that is all. So this is first consult, this is follow-up consult. Please don't apply it in any other part of telemedicine. It is applicable only when you want to prescribe medicines, nothing beyond that. And you want to look into those 4 lists. That's all, Dr. Pandey.
Got it. So you got it. I mean, you did allude to something which we will come to in terms of the list that has been brought in as list O, A, B, and prohibited. We'll come to that in a short while. Ketan, you have been practicing telemedicine in terms of in complete lockdown, all telemedicine, and switching over gradually to an open up where people come in double mask and you in your hospital do that very important social distancing, playing safe. Tell me a little bit about that, because many young urologists at this point, there are 621 people viewing this live. So for all the panelists who could actually be interrupted when you keep talking around, or you could raise your hands and probably get an answer to speak up in between. There are 621 people watching you live because they're all enthused. Dr. Shroff, each of them today night after the program is over and after the dinner is served on table, will go back and read and get more enthused. From tomorrow onwards, we'll see more of this teleconsult. So that's looking great. We should go back and read it and probably polish ourselves. Ketan, would you take us through a journey where a young urologist will take it up in a solo hospital? How do you do it?
So, what you want to ask is how to practice in the corona, post-corona?
Yes, absolutely. As we are going through the last 6 months.
Offline.
Yes, go ahead. How are you doing it?
See, there are, when you are practicing in a hospital or a corporate hospital, a solo hospital, there are 4 areas where you need to work on. One is area means for the patient, you need to take special care. Second is you need to take special care for your staff. You need to take special care when you are in a consulting room. And you need to take, fourth is you need to take a special care when you are operating. So all these 4 areas needs to be very much precisely defined, all the care, and you have to see that all the your guidelines are followed properly. Like in my hospital, when the patient comes, right from his entry, he has to wash his hand with the sanitizer. We give them gloves. We ask them to put the shoe cover also. And if they are not having proper mask, we provide them mask also. And when they come in a waiting room, there is a enough spacing when they are sitting, and no crowding is allowed. Even the waiting area, AC are full running, but the windows are open so that there is not much breathing problem, and air circulation is very good. Even when they come for my consulting room, AC is on, and they have the chairs which used to be near my table. Now they are little bit far, at least 6-7 feet away. And usually the patients try to come and talk when they come and they want to sit near you. I tell them that it is for you. You sit away from me. My voice you will be able to hear me properly. And whatever I want to show you on my big computer screen, I can show them, explain them properly. So simultaneously your staff, all the staff and we ourselves, we put proper mask, N95 mask, as well as face shield. It's compulsory for all my staff. and we give them gown also in OPD also, and in the clinical area also, where nursing staff is also given gowns.
Wonderful, Ketan. But let me know about your teleconsult. This is great practice you're doing and playing safe with everybody. Opening up the AC, opening the windows, making them feel safe, keeping them social distant, and getting them all that is required towards the distancing. Tell me about your teleconsult, which you talked to me today morning, and you said that is actually booming from complete lockdown to changing it.
So now what we have done, there are so many patients from outside the state, outside the city. We give them appointment. The teleconsultation time is a totally different time. It is not the usual consultation our time when I do teleconsultation. The teleconsultation time is a separate 1 hour or 2 hour time is devoted for the teleconsultation. Not only that, my secretary give them all the information regarding how they can pay about it before the teleconsultation. Whatever the reports they want to show me, they are supposed.
You are muted.
Ketan, have I lost you?
I go through all these things.
Yeah.
Sometimes there are certain conditions like there are spot diagnoses where they are having some ulcers on the glands, or they are having some pain, or they are concerned about that. Even the photographs, we ask them to submit the photographs also, and the photographs of the reports also. So that, and once the teleconsultation or video consultation is done, everything is put on the consultation paper. And I mentioned that this is a teleconsultation, and all the history and whatever the investigations or the physical, like pedal edema, I can see, penile edema, I can see, scrotal edema, I can see. So all those things are put on the paper, and advice of all, any investigation is advised. Then they come with the investigation, or investigation is already there. And if I have prescribed, it is on the consultation paper. So that is there. As well as, there are certain conditions we can't prescribe them, or they need to come, like voiding problem. They are having incontinence. Then I need to examine. I have to convey to them that I can't just by teleconsultation I can consult you. You need to come. Or sometimes if they are out in certain places where urologist is available, like Jodhpur, Jaipur, they consult me. Then I ask them, you please go to a certain urologist, and then you revert back to me with the reports.
Awesome. Ketan, Ketan, Dr. Shroff is smiling and he's happy about what he had dreamt 20 years ago and dreamt all the time is actually being spoken live as it's being practiced right now. It actually feels proud when we hear all that. So on average, just tell me in one sentence, how many telemedicine consults you see in a day? Or there are telemedicine days and there are OPD days. How many telemedicines you do? Because you said you devote time, you look at reports, secretarial activities. How many in a day or how many in a week?
See, daily I'm consulting at least 7 to 8 patients on telemedicine daily.
Terrific.
And around still, even with that also, there are 17 to 20 offline in the consulting room patients are also there. So that is my daily routine.
Got it.
I have developed.
So you are enthusing a lot of young colleagues of ours who are going to take it up in a big way. You're looking at all that. Dr. Rajiv Tipi, I want to come to you because Dr. Ketan did allude to a word called COVID-19 times. Dr. Rajiv, can you just briefly help us about this COVID-19 guidelines developed by the Urology Society of India so that we can balance our offline and online consults better? Dr. Rajiv Tipi.
Sanjay, you are aware that USI is a growing society. We have more than 4,000 odd urologists under our roof. And in the initial stages of COVID, patient care has been put on hold by various reasons. And many patients who were requiring treatment were not getting in the initial stages. So either people were trying to defer it for this reason or that reason. Now, coming to at that moment only, very well as this rule of telemedicine came in, and Dr. Shroff was one of our member who had pushed it through of having medicine thing, and we had formulated a guideline for the Urological Society of India, and he was one of the architects for this, and we had put it on our website, the telecommunication guidelines, how to treat various conditions and other things. Definitely, this has helped majority of the people to tackle various disease conditions to a certain extent, even though if not fully. Even I, coming to my own hospital, I am in a government setup. We had formed a telecommunication OPD, and this was purely on voluntary basis. The administration gave a circular that we want to have a telecommunication OPD for those people who are from the interior areas, who cannot come because of lot of problems. Yes, there is lockdown, they cannot travel across. So they were asking people who can enroll into it. So many of us has enrolled into it, and we were given specific timings for having this telecommunication consultation. So this has helped to tide over some emergencies, if not fully, because as Ketan has said, some of the things that the patient has to come over, but still some of the immediate emergency situation can be tackled, especially through the video. For example, that we can examine the patient through the video, but certain form of examination cannot be done. And this has helped to a great extent, because at one point of time, our OPD was having hardly no new patients, because patients were scared to come to our hospital because ours was a COVID hospital. At the same time, we have to tackle these patients, especially uro-oncology patients who were running on chemotherapy. And this has helped because the colleagues in other districts also helped us, because we are giving them ideas how to tackle those situations, the general surgeons and others, in this period of time for to tide over the crisis. But I say, in due course of time, in the coming era, this telemedicine, this tele thing is there to stay, and it can really tide over the emergency problem in the end. But those people who have to come, we can call them over after tiding over the crisis. And this is a great initiative. Anyway, even though the government of India had a different perspective a year or later, but with the COVID, they have totally changed and helped us. One of the things is that I wanted to ask you, still I'm not clear, the legal implications related to the telemedicine. If we prescribe something on the telemedicine, how far some patient says, gives a consumer protection code that I have been prescribed this is wrong, this has happened. Where we, the doctors, will stand, that thing has to be clarified into.
Yeah, we will request Bajpayee Saab in a due course of time to help us out and help us as lay people to get that legality cleared. Before I come to Professor Shroff, let me just tell that, Professor Shroff, there's a certificate course which is an hand-holding kind of an attempt that you have taken over, which is now completely in the purview of the telemedicine guidelines around. I did talk to 3 people today morning. I took this liberty for those 3 people to call them and ask them, how does this telemedicine certificate course that has been started look like? And believe me, the entire thing about promoting it to that level, where you are hand-holding doctors to take it forward, able to help them bridge the divide, which is so important, and them feeling little safe enabler of health, is probably a little different from what we must have thought. Friends, while you are all watching these luminaries around, I know you are 622 people live right now. My request will be for you to ask questions to them directly, which I'll transmit to them. And Anwar Ali, your question actually from Pune goes to Dr. Shroff directly. Sir, Dr. Shroff, there is a direct question to you in terms of looking at, this has not been a usual practice of checking patients physically and recommending medicines based on that. That means we've always been used of talking to them, pleasantries, putting them on the bed, examining their kidneys and genitals, looking at them, talking, and then bringing them back, doing a hello, and then probably giving them medicines. Now, this looks like the entire telemedicine change that we have adapted ourselves, and half of them are telemedicine, half of them are offline consult. basically gives comfort and attention of the doctor to a patient so much. That means we always have been hand holding in medicines and journey around. How are you dealing with the psychology of these patients and making them understand? Because irrespective of what, there's the family sitting out there and we talk to them and we take it forward. So important to be able to enthuse that you are really the one who wants to help them out and actually handhold till they can come back or till we start them on treatment. That important first concern with Bajpayee Sahab alluded to from the legal point of view or guidelines point of view and helping them out. Anwar's question directly is, how are you psychologically supporting them, helping them out, taking this journey on teleconsult, which could be a second, third consult before you engage them, investigate and treat them? Dr. Shroff.
So, Sanjay, that's a very good question. In this COVID times, patients are scared to come to hospital. So once the COVID is over, then the psychological support will be more needed, I think. At the moment, with COVID, when we say that you can come on teleconsult, they're very happy. And they willingly agree. So, they're really scared. At least in Chennai, they're scared. I don't know how it is in Maharashtra. But in my place, and there are patients, I'll tell you there are different categories of telemedicine, which is very helpful. Follow-up patients. You have a BPH patient who is on, the alpha blocker, who really wants to, consult you after 6 months, 1 year, who's on follow-up consult. And he's going to spend less than 5 minutes on in your room. And even in consulting in normal circumstance, you're unlikely to examine him. In that situation, you may just ask him about his flow, how he's doing, his nighttime, and so on, and then prescribe the medication. So your one category of patient is follow-up, which is very simple to and safe telemedicine, where you don't have any problem. So even if you're scared of legal implication, you apply telemedicine as an extension of your practice. It is not different from a normal practice to that. If there's a new patient and you need to see the new patient, and you're not able to examine the patient. If examination is required, let's say patient has got retention of urine or acute colic, he has to come in as an emergency. All you can say to the patient is give him emergency advice if they come to you by saying that next available kind of time, go and visit the emergency center. Meanwhile, you can say, you can take this painkiller, tide over this problem and come to an emergency room. But you can't go beyond that because you can't examine the patient. So emergency consult, no. Routine consultation, yes. And as an RMP, as a doctor, you need to assess each situation. What mode of consultation you want, whether you want video, whether you want audio. A follow-up could be audio. But if you're going to prescribe medication, it has to be a video according to the legal framework. You can't prescribe medication if it's not a video consultation. And you will need to go into the history taking of the patient. And then is it the patient asking for consultation or is it the caregiver asking for consultation? So then again, the consent varies. Is it implied consent or an explicit consent? If it's a caregiver, then you have to make sure that the consent is documented, as a consent form. But if the patient asks for a consult, this is implied. All you have to do is write in your register, like you do in your clinic, that the patient has come to you, just like he comes in clinic. So use telemedicine as an extension of practice. Always ask the right questions. And then spend enough time. In fact, telemedicine consultations take longer time than normal consultation, believe me.
Yeah.
I always felt that telemedicine takes more of my time, sucks in more of my time than normal consultation.
True.
I want the patient to be comfortable. And one trick which I do, whatever advice I ask the patient, I ask him to repeat it. I want to be sure that he has understood what I have asked him.
Yeah.
If I'm writing prescription and transmitting, I make sure I write it in capital letters. I make sure I write the dose completely. I make sure how many days I write it for. And when you sign the prescription, I make sure my registration number is there, because these are all requirements of an e-prescription. So that is what I do in my practice. So I spend more time. So psychologically, patient is happier when he goes back after the consultation. Rajiv is raising his hand.
Super. Rajiv TP sir, can you unmute yourself? Dr. Rajiv TP, can you unmute yourself? Before I go to the legal angles, which I feel so happy, and Bajpayee Sahab, you will feel so happy about it before I come to you. Let me go to Rajiv TP once. Dr. Rajiv TP, you want to add something to this?
Yeah. See, regarding the telecom, 60% of your diagnosis is made from the history.
So nice.
Even on medicine, you take a detailed history. 60% comes from that. Now, how many of the doctors who are really seeing the patient physically, examine the patient totally, hardly 20%, to see whether the patient is having any retention and everything. Even if we say you drop down, see, I don't think in this COVID era, even anyone who is sitting in the OPD, hardly 20% does physical examination. The rest of the examination goes on the usual, that ultrasound imaging, which forms the part and parcel of the physical examination. So 60% of all your thing is based on an appropriate and very specific and detailed history taking. So as Professor Schroff has said, I really agree with him. So telecommunication medicine, when you teleconsult, you have kind of have a video consult that will give you, only one thing is that when you prescribe the medicine, you should keep a copy of whatever you are prescribed with you, then take the image of it and transfer across to the patient. You should always have on record the prescription which you have kept to the patient.
Got it. Super. So Dr. Anwar Ali from Pune, thank you so much for asking that question, which is all about hand-holding the patients around in the first consult, psychologically keeping them spruced up, that more of the family members watch while we consult one-to-one and add more inputs like the family adds when they sit around. I'm going to go to the legal angle right now, and we are enjoying it. So the legal angle here would be, Dr. Anwar Ali, your question on this, and I would take it to Dr. Bajpayee before I come to some patient-permitted settings around. Bajpayee Saab, the question is to you. Can you please throw some light on the medical negligence case possibility in a case of an audio communication where it's difficult for the patients to prove negligence due to inadmissibility of the recordings or many times unavailability of such recordings? This is a direct question to you from Anwar Ali again in Pune. There are so many comments coming up. I'm picking up all those questions which I can as we go through the journey. So the entire medical negligence of audio communication where difficult for the patients to prove negligence is something very important. Bajpayee Saab.
You are right when you say that tape recorded audio communication is inadmissible in evidence. Okay, because there is the Indian Telegraph Act which says that it was made 100 years, 150 years back. Telephone lines, if they have to be taped, then yes, you have to take permission from the Home Minister and a hell lot of procedures have to be followed. So legally, until and unless the telephone has been taped, legally it can't happen. But today, all the platforms which are there, apps which are there, they are recording it. So I myself am in a fix. If they are recording it for, therapeutic purpose, whether there is permissible, I beg to differ. No, it's not permissible. At least in these guidelines, I do understand MCI did not have the jurisdiction. But a bigger law, very comprehensive law and all-encompassing law is bound to come. It should come. But yes, he can't produce it. But don't forget one thing. The patient today is tape recording everything. Not only when he is there on telemedicine, but when he has come to visit you, when there is a patient who is hospitalized, please take it for granted that all your bedhead tickets and nurses' notes, they have been photographed for eternity. So please work on those lines. Whether it would be admissible later on, not admissible, I am a poor lawyer, Dr. Pandey. So till now, till the time this dispute reaches the court and the court comes to a conclusion saying that, oh no, if telemedicine practice has been done and the patient has recorded it or the doctor has recorded it, is not illegal. Then only I will be able to say whether it is admissible. Prima facie, yes, it is inadmissible. But now with the telemedicine practice guidelines, again, the telemedicine practice guidelines are not giving you, Dr. Schroff, please correct me. I don't find a single line there which is permitting you to tape record, to video record your conversation or your video interaction. If a single line was there, then as a lawyer, I would have said, no, this will protect a doctor or a patient. No, the telemedicine practice guideline is giving me permission, so I am doing it. There is one law against another law. So, Dr. Pandey, we will leave it for some other time.
Yes, I got it. Bajpayee Saab. I'm taking a cue from Dr. Shroff and coming to you, Bajpayee Saab, on this permitted settings interaction. Dr. Shroff did talk about this. He did talk about it could be to a doctor, it could be to an attendant. Could you help us out in the legalities out here, or what has been framed by the telemedicine rules right now, that it can be a patient to doctor, or it can be with a list of people whom I can interact with in a telemedicine?
Anyone connected with the patient, if I could put it in a single sentence.
Yeah.
Anyone or everyone who is connected with the patient can consult the doctor. But there are many ifs and buts. 3 distinct categories are there. One of them happens to be attendants. Now, in this category, you will have, or rather, the legal word or technical word that has been used is caregiver. It could be a relative, it could be an attendant. All these people, they come under the category of caregiver. So yes, on behalf of the patient, a caregiver can speak with the doctor on telemedicine. The second category happens to be your paramedics, another doctor, a nurse, a healthcare professional. They can speak on behalf of the patient or for and on behalf of the patient. Okay. The third category is another doctor, an independent consultant. He or she also can speak with the treating doctor. But yes, if someone other than the patient has to speak and the patient is not there, now here comes the problem. An audio call, you never know whether the patient is there or not there. A video call, yes, the frame is there. You can always insist on that caregiver or on that paramedic or that doctor. Where is the patient? Let the patient remain in the frame and then you speak with me. But if it is an audio call, what do you do? So there are certain practical suggestions, Dr. Pandey. For example, in urology, I don't see that emergency or that frequent interaction between doctor and patient. But in some practices like gynecs or rather obstetric antenatal care, there could be an emergency. So what stops that obstetrician from taking an advance consent, an advance verification? My mother-in-law will talk with you, my father-in-law will talk with you. Give me their identification proof. Give me an authority, I will speak with them. Law is absolutely clearly permitting you to interact with these people, but they have to be identified and there has to be a positive authorization from the patient. If the patient is competent, if the patient is of unsound mind, patient happens to be a minor, then yes, someone on behalf of the patient, parents or relatives, they can speak with the doctor. Nothing is required. An unconscious patient, a patient in emergency, someone on behalf of the patient can speak with the doctor and doctor can very well speak with that patient. That all has been permitted in black and white. Something that was in the unclear zone, in the gray zone, or rather not permitted in your in-person consultations. Yes, Dr. Pandey.
Terrific. So before I come to Dr. Rajiv TP, I must tell you that there are 716 live audience right now. I must tell you, the entire country watches from Jammu to Nagarcoil and right from the eastern to the western borders of the country, which means that each of you happen to be a live audience. I can see wonderful questions from Dr. Mayank and Dr. Srinivas. Mayank from Jaipur and Srinivas from Hyderabad. Wonderful questions. I'm going to take all these questions, but I will let Rajiv TP, sir, to give your comments on this.
My question is to the legal luminary Mahendra Kumar Vajpayee. I think one thing is that since it's a telemedicine and teleconsultation, one thing there should be a consent. That is, the patient agrees to have a teleconsultation with so-and-so doctor, and it is on his own will he is having consultation with this doctor. That is one teleconsultation. Secondly, audio consultation, in my view, as a USI secretary, because behind the screen it may be A, B, C, may not be a patient, maybe someone may. So always it should be a video consultation. Thirdly, how far a doctor can be dragged into the Consumer Protection Act by this video consultation, because a doctor, by his open heart, is rendering service to the best of his knowledge, to the best of his ability. A, B, C, D specialists may have difference of opinion. Suppose one doctor gives on a video call, gives his opinion. He goes the next day to another doctor of urologist for a video consult, gives another opinion. So should there be any restriction on this for a patient taking multiple video consultation with multiple urologists in a very short span of time?
Bhakri Saab, you want to talk on this? It should always be a video consult. A patient getting into multiple consults. Go ahead, sir.
3 questions. You want me to answer all of them?
Please go ahead. Please go ahead.
So yes, please understand the consent in telemedicine is a very simple consent. I understand you are urologist, you do surgeries. The written informed consent that you take in surgery is quite different from the consent that you are going to take here. For that consent, you have to counsel the patient, give him the alternatives, give him the prognosis, how much time, what are the risk, complication, give him time to contemplate, then take a consent. Maybe you may have to take witnesses, you have to sign. Here the consent is very simple. Yes, doctor, I agree for consultation, that is all. And as Dr. Shroff has pointed out earlier, if the patient has initiated the call, even this is not required. Consent is deemed, it is implicit. Patient has given consent. Patient may ask for an appointment with your secretary. Deemed consent. Patient has come on his own. Okay. So, yes, consent is required. It's a very simple consent. Please don't let it come as a barrier for telemedicine. Simple consent. Now, as far as Dr. Rajiv said about audio, I beg to differ with him that you must always do video. You are restricting yourself. These guidelines are very clear. If the call has come from a registered number, if the email has come from a registered known email ID, you don't need to ask anything further. The identification of the patient is done. That is what the telemedicine guidelines are saying. That once you have initiated a call, you must identify yourself to the patient, as Dr. Shroff has rightly pointed out. I write my name, I write my qualification, I write my registration number, I write the state medical council, 4 bits of information. Identification of the doctor is complete. Now you have to identify the patient. How that has been left to you. You identify the patient positively. But at the same time, the guideline says, if it has come from a registered number, if the call is coming from a registered email ID, fair enough, identification of the patient is complete. Please don't stop audio. You have been permitted. You can do audio consultation. In fact, you can do on WhatsApp.
Text also.
You can do it on SMS. Please don't stop. The third one, how far Consumer Protection Act, please understand, there is no dilution in the standard of care.
Perfect.
Whatever was expected in your in-person consultation, the same standard of care is expected here. Absolute no dilution. Law has given you a privilege. You can say no to teleconsultation at the outset.
True. Your discretion.
Very comfortable arguing on these mobiles and digitally. I am not accepting brief.
Super.
Fair. You can say I don't want to. You have all the liberties in between. When a teleconsultation is on, you can always say, sorry, now I am not comfortable. My connectivity is not good. Or you are a person with whom I am not comfortable, you can very well stop that. This right has been given to the patient also.
Yes.
You can't insist the patient, no, I want you on a telemedicine. No, he also has that right. Now, patient differing opinions, I don't think this is the platform, but I would request Dr. Rajiv just to read Bolam's law. Simply because a doctor has a different opinion from you, you are not negligent.
Absolutely.
Patient has all the rights to take 10 opinions on one day.
Absolutely.
Can get 10 differing opinions. What is important is the opinion that you gave.
That's right.
Whether it is in accordance with medical science, whether it is in accordance with medical practice, yes, then don't bother. Wherever the patient wants to go, the patient will go. Let him go.
True.
Super.
Doctors are unnecessarily troubled about law. Sorry. The chances of a doctor getting hurt, getting killed by a car accident is 100 times more than getting sued.
True, very true.
So well said. So well said, Bajpayee sir. Yeah.
It is merely your medical science that you should be clear about. Follow it. Law is on your side.
Thank you. Good.
Thank you so much. Thank you so
Yes,
much, Bajpayee sir. Professor Shroff, I'm coming to you. You know, Mayank from Jaipur and Srinivas from Hyderabad have sent questions. This is really a live audience right now. They are actually interacting with the pioneers. 726 people watching you live from the entire country. Professor Shroff, the first question is from Mayank, Dr. Mayank from Jaipur. If a patient is not satisfied with teleconsultation, can he ask for a refund of consulting fees paid to a urologist? Your experience on that? I know the answer from telemedicine law, which Bajpayee sir will speak up as a corollary later on. But tell us, can somebody ask, you've given your services, you spent your time, you explained to him well. Go ahead, sir.
So very simple, Sanjay. Let's reverse it. Let's say in person, a patient comes and he's not happy with the consultation and says that I want refund of my fee. What will you do? Do the same thing.
Yeah.
If you're going to refund. If you think that you're not given a good job, it's your discretion. A patient can ask, but you have given your time, and that is your professional fees. And that has been in advance told the patient that if you want to consult me, it'll cost you 1,000 rupees. I will give my time. I'm a professional. So if he's not happy, you want to give, it's your heart. If you want to give of goodness of your heart, you give it. But law can't prevent you from, if you don't give it, law can't sue you for that. Because you're giving your time and you told the patient in advance. And what you need to do in telemedicine also is, you need to give the patient a receipt of your consultation fee as well. I charge 500 or 1,000. You need to give the receipt. That the patient is entitled to, but not entitled to for a refund.
Got it. So, Professor Shroff, I can take two things here. Number one is, there are patients who come for stones. They come and sit outside in your and my and Ketan's OPD. Later on, after waiting for 1 hour, with a busy OPD, they come inside and you find that they have got gallstones and pancreatic stones. You won't immediately refer them out. In a corporate hospital like this, I can refer to a gastroenterologist. They've been made to wait for 45 minutes, 1 hour, only because of the queue. They come in around, and they're a little annoyed that you don't do gallstones anymore. We were told stones, and we came in, and we know that you are a doctor of stones. Then it becomes that you refund and you say, please, direct, and you help them out, you call them up.
Absolutely.
Yeah. Super. Number one. Number two is that we are all born out of Hippocratic oath. That's the womb from which we came out. And then we follow standards, policies, practices, and standards of care. The next question is important for you, Professor Shroff. This is from Srinivas in Hyderabad. Is it safe for a urologist to share his bank account details with a patient for depositing fees online? Are there any risks, any precautions? Srinivas, your answer is being given by Professor Shroff. Bank details.
See, bank details means, nowadays, all this NIFT transfer and all happens. So it's not a big deal to give that, number. Now, he's not going to hack into your bank account. If he's going to hack into bank account, he's going to hack into the bank itself. So don't worry too much about all that. And many of these applications which are there, they take you the money, like when they come to your clinic. Again, I go back to your physical consultation. Whenever you have doubt in telemedicine, go back to your physical, how you do it normally, and it'll give you an answer. Many hospitals will charge the patient in advance, and many hospitals will charge a patient afterwards, isn't it?
Yeah.
So if in many of these apps, they will charge you in advance before you consult a doctor, and you pay the money, and it goes into the account. And if a patient is asking for your account, you can comfortably give your account number. It's not going to, he's not going to hack into your account. Don't worry.
Got it. So, this was good. Srini, thank you for asking that question. You're actually blowing the lid of those doubts, and that's where I want the live audience to be answering it all the time. Professor Shroff, there's a question from Mumbai. Dev Pardhanani Saab, thank you so much for asking this question. If the patient's problem is amenable and the patient is open both for an offline and an online consult, what would be your preference as a clinician?
So in
A pioneer in this. In COVID times and in post-COVID times. Professor Shroff?
COVID times, I would suggest that he comes for teleconsultation and he's amenable, meaning that he may not want to, he can come for teleconsultation. Let him come for a short teleconsultation. If I feel that he needs a physical examination, I'll ask him to come for physical consultation. So it is the patient choice. I can give him both the choices. He can come to the hospital and consult me, or he can come, to online and consult. So both are open to this. But I won't tell. What the guidelines say is, don't insist that you come only for teleconsultation. That is very important. If a patient wants to come for in-person consultation, don't say that come for teleconsultation. That is not allowed. But it's the patient choice.
Got it.
Ketan wants to say something.
Yeah. So Ketan, actually, you will tell me about this, about the bank account details. Your one sentence on that, about the safety feeling that you have, about you having refused anybody on teleconsult for us to know live, for my colleagues to know it, and finally your offline online consult on a COVID non-COVID patient with preferences.
So the question first which came, that if patient asks for the refund and if he is not satisfied, I would like to add one thing, that usually doctor-patient relationship, we should never, basically it is based on trust.
Absolutely.
And if the patient, first of thing, we should have trust in ourselves that we give satisfaction to the patient when we are consulting either online or offline. And if patient is not satisfied, usually that does not happen if you are very true to your heart and you give satisfaction till the patient is having all the questions have been queried. And don't suspect that if you have given your 100%, usually patient, they don't ask money back. In fact, what happened once, one of my follow-up patient happens to be a doctor. He took an appointment from my secretary from out of station, and he took the appointment. Secretary told him that he has to pay money. So he paid money. And then when I did consultation, I came to know, oh, this is a guy who is a doctor. So I refunded him the money back. That because I don't charge for the doctor, then even though he had paid me, so what is wrong in paying back the money if you feel that you need to give it back? So when first thing is you need to give your 100% to the patient. Patient will also trust you, and they don't usually create unnecessary nuisance for money also.
Good one. The other thing which I wanted to look at, Ketan, is about your worry on bank details and all that. You want to give in one sentence? Are you okay with this bank detail issues?
Yes. I give them bank detail for RTGS also. I mean, if they want to do RTGS, then also there are Paytm. I use Paytm. I use Google Pay also. On that, I give them options. If whatever the options they want to get it. So
wonderful. Wonderful. So it looks like, Ketan, on a very lighter note, RTGS means some big amounts are being transferred. Thank you so much for that. So let's go to Bajpayee Saab. Bajpayee Saab, your comments on this, please.
No. Oh, yeah, only one simple line. Have a special bank account only for your telemedicine transaction.
Okay.
And don't use it for any other purpose. Safe.
It's safe that you have an account which is only for this for multiple reasons.
I also have one more suggestion on the same line. Have your, most of the teleconsultations happen on this, right? So have a different number. Don't have the same one number.
Terrific.
If you have the same number, what happens is sometimes, you don't want to be called, so you can switch it off, because you can put your, the telemedicine time I'm going to do from this time to this time and put it on your home page. So, having a different number always helps so that you don't get called at odd hours.
Got it. So we're advancing with technology and we're going to meet expectations of patients. So 1.3 billion people, 2.6 billion telephones is what that will be great actually that we have another one directly for this.
Smartphones in the country now.
Yes. Completely fine. Bajpayee Saab, I want to come to you on this important aspect because I'm actually soaked and immersed in the kind of discussion happening. The luminaries, friends, I would like you to utilize this chance to ask your questions, which could be as difficult as actually we're going through. Bajpai Saab, coming to you, we're looking at two important aspects. Number one, you did talk about and allude to the drug list, a very important aspect that we need to know on drug list. A little bit idea because we all will go back and read today on these drugs. The drug O, the drug A, the drug B,
Yes.
and the prohibited
Yes.
list. Yeah.
Sorry to interrupt, but I actually have a slide on that because I don't think so it's so fair to ask him that question. Mr. Bajpai, with your permission, can I show a slide on this? Because I think this is an important question, which you
please go ahead, Professor Shroff.
show a slide.
He can leave a comment later on. Bajpai Saab will leave a comment. Professor Shroff, if you can show a slide, because friends will be keen to know it.
Which is, I think, important for people to know.
Please.
1 second, let me just show.
Please go ahead. Take your time on that because that's very important for us to know because there is something happening on this on an update change. Kindly show us those important prescription slides.
Are, as Mr. Bajpai said, four, and you said four kind of lists. One is list O, over-the-counter medication. Common over-the-counter medication includes paracetamols, anti-cough, cough syrups, as I said, and then those supplements, vitamins, and so on, and then ointments as well. You can use.
So whom can we prescribe this, Professor Shroff? Whom can we prescribe this?
So over-the-counter O medication, you can prescribe anytime to anybody. Okay.
Yeah.
Preferably, even then, although you can do it, preferably, but when you're doing a video chat, preferably. Okay. Then there is a medication notified by Government of India from time to time on emergency basis, like chloroquine has been for malaria and so on. So that is a list O medication. Okay. And then there is a list A, which means list A are first consult medication, only on video mode of consultation. This word has to be, this sentence has to be noted, such as ointments, your eye ointments, skin ointments, ear drop, follow-up consult for above medication, follow-up medication for chronic illness or refill, for, such as for hypertension, for diabetes, for asthma, and then it says, etc. Now, here is what I want to appeal to Rajiv TP. This document is in, kind of a living document. When this document came up, immediately the psychiatrist appealed to the MCI board that it doesn't cover anti-anxiety medication. So MCI came up with this additional guideline immediately and said clomazepam, anti-anxiety medication, phenobarbital was added to the list. A. Got it? So I want Rajiv TP and company from your side to write to MCI saying that alpha blockers, and 5-alpha reductase inhibitors, some of these medication can be included in list A quite comfortably. And we want that recommendation to come from USI so that we can take it up with MCI. It has to come from a society. Okay, got it? This came from the psychiatric body. That's why it was included in list A. And then there is a list B. This is a list B is follow-up medication prescribed, like you want to change the medication for chronic medication. And this includes, again, diabetes and etc. Follow-up medications are medication when the patient is coming back to you for consultation, either after, after physical consultation is coming back on a video consultation at that time, or he has done a, first consultation on video and then come back. These are the follow-up medication called list B. So you've got now three levels of medication. And then there's a prohibited medication, includes Schedule X, narcotics, and psychotropic drugs. So these are the medication. As you see, none of them mentions any of the urology medication, okay? Only term uses, etc. It is left to the discretion of the urologist to use your medication, alpha blockers, or 5-alpha reductase inhibitors, or whatever. But after having explained all the side effects of the medication, after making sure the patient understands about hypotension, not getting up in the middle of the night and feeling giddy, all this needs to be explained to the patient before you prescribe the medication, and that needs to be documented that you have explained to the patient. This is where the etc. will come, but we are not very comfortable with the term etc. So, Rajiv, please write to the us, and we'll forward your recommendation to the Government of India. So this is about medication, Sanjay. I just wanted to show this.
Got it. Perfectly fine. This was great. This was great, actually. As people watch this, thank you so much, Professor Shroff, on this. Before I come to Bajpai Saab, Dr. Rajiv TP. Rajiv TP, your comments on this?
No, since Professor Shroff has highlighted this thing, certain commonly used urological medications. For example, he has said about alpha blockers, 5-alpha reductase inhibitors, and even overactive bladder.
Anticholinergics.
Overactive bladder.
Yeah.
This antimuscarinics. This we will definitely write to them to incorporate into the list A, because these are the most common medications which a urologist prescribe. This will be definitely taken care into, sir, and we will do it.
You know, Rajiv, see, I would also make one more suggestion. This is the time that USI forms a telemedicine cell for urology, so that this is a living document, the guidelines, this is going to change. So whatever we are facing problems, in our specialty, especially, and another thing which we need to be very careful is sharing pictures, where our pictures are mostly very, very confidential pictures of privacy, issues are huge in our pictures which come. We're not supposed to share those pictures even with our colleagues without,
Yeah.
So we need to put all this in place so that these pictures don't go viral on the net. You know what can happen? You send it on a WhatsApp, by mistake you forward it to somebody else and it can go viral. So we have to be extremely careful of these things. So that's why I'm saying that it is high time that Urological Society of India forms a telemedicine cell and gets in, few people together so that we can keep our people informed, our urologists informed, at the same time write those guidelines and make some recommendations to our own society members and to MCI to include all those things.
Dr. Shroff, can I just add something here to Dr. Rajiv TP? Dr. Rajiv, can I add something here? Dr. Rajiv, this is for you. This is for you in terms of, we heard Dr. Shroff, and I'm taking a cue from that. The cue is...
The comment placed by Professor Shroff.
Yeah.
Sir, I will see that by 9th of November, there will be a telecommunication cell of Urological Society of India.
Very good.
This is the word given by me, and you will see to it on 9th of November.
So on behalf of Telemedicine Society of India, I'll request you to kind of have a chapter of within your
absolutely
site, so that we can keep guiding you as we evolve.
Now we will have a telecommunication cell which will guide USI and formulate whatever that is required to our urological fraternity to incorporate into the telemedicine guidelines.
Thank you.
Wonderful.
Yes, I assure you, and I will see that it is true.
Thank you.
Dr. Rajiv, 1/3 of individuals, we have got 741 people watching you live. 1/3 of them are actually students in urology.
Yes.
Would it be prudent at this point in time, Dr. Rajiv and Dr. Shroff, to add it as a part of our accessory MCH curriculum training? Because the boys who will pass in 2021 and 2022 will actually maybe starting from a teleconsult practice itself. Who knows? We have a second wave right now in Europe happening around. So would it be a part of the curriculum to, apart from telemedicine cell in USI, could be a part of an accessory curriculum? May not be a pass marks in that, but it could be an addendum for them to be enthused as a step on the first day after their pass marks. They actually look into that. Rajiv TP, your comment on that, please.
Sanjay, as you know, that all these things have come because of the recent pandemic. And it is very clear from the situation what we have faced during the last 7 months during this pandemic regarding the patient care and other things, and the various confusions regarding the same. Henceforth, we definitely, with the help of the telecommunication cell, which I have made an assurance before you now, we will set up a cell with making guidelines, and we will see that we can incorporate a sort of a curriculum early in the course of the urological DNB or MCH, thereby making tomorrow's clinicians more aware of the options of the telemedicine and how to carry forward in the future directions.
So I just wanted, Sanjay, to spare a minute for me here. What we could do, Rajiv, I mean, we could take this discussion offline, but what we could do is, in Telemedicine Society of India, we are developing specialty courses now for every specialty. So what we're doing is we are giving a basics of telemedicine, this course of what the guidelines says, and then we are adding a 45 minutes module just for the specialty, whether it's diabetes or cardiology or urology. So as a society, we will write to you from TSI to Urology Society that we will develop a course along with USI, which you can use and give it to your students and to the urologists so that they can practice safe telemedicine. Because even the MCI course which comes, will be very specific and a very broad course. It will not apply necessarily to urology alone. It will be very broad, and there will be still elements of doubt. So what we are suggesting is every specialty should develop one module special for the specialty, which makes sense, and develop that as a curriculum, along with the basic course, of the MCI.
I really agree with this, because since I am handling with the Urological Society of India only,
Yes.
I will take the lead of Urological Society of India and see that the cell is formed.
Yes.
And as long as I am there, I will be after the cell to formulate something and incorporate for our urology trainees as a thing to go forward with the thing, so that other societies also can take something from the Urological Society.
Absolutely.
That's right. That's right, Dr. Rajiv TP leading from the front. Urology, dial U for urology back in the alphabetical order, but you brought to the front foot. Thank you so much on that. Dr. NP Gupta, thank you for those wonderful comments for Bajpayee Saab and for Professor Shroff. Dr. Manor, thank you for those wonderful comments for Dr. Ketan and Dr. Rajiv TP, sir. And rightly, Joseph, sir, from Cochin, you stole the very point which I spoke, which means that you all have the same kind of wavelength as urologists. Bajpayee, you will be enjoying that. The amount of comments coming in for you and for colleagues in urology is just enormous. I just got a call from ladies in the country saying that Friday lunch is being served at 9:30, so you can keep these boys engaged till the lunch is till the dinner is ready. So I think start enjoying for a while. The weekend dinner, the ladies will prepare a little later. So to me, there is an important question, Dr. Joseph. Thank you, sir. Rajiv TP sir has promised MCI's curriculum will be better. It will be more add-on and more practical for people to join in. And there is Dr. Ajit Saxena coming up with a wonderful question. He says, andrological practice is rather tricky. Any do's and don'ts? Ketan, you want to add a sentence before I go to Dr. Shroff on andrological practice? He very rightly said, you can't share pictures. If I have a doubt and I have to call Dr. Rupin Shah, I can't share a picture. That's what Dr. Shroff told me. So Ketan, tell me about it in short.
Can you
andrological practice?
Okay. Andrology practice. See,
yeah.
There are certain andrology questions like erectile dysfunction. You can hear them out. You can diagnose what exactly is going on with a good history, and but even during the lockdown, I have got a patients of paranoid disease which have sent their photographs of their problem and sending that this much is the problem, and now what I have to do. Then I advise them that, see, this is the problem, these are the options, and ultimately there may be a surgery. So that thing, but surgery right now, it was a lockdown time. So I told him that is an elective surgery. So you are having an option of not going for the surgery right now when the corona numbers are very high. So all those type of consultation can be done on online also.
Yes, got it. So Ajit sir, thank you so much for asking the question. You're enthusing, A for Ajit and A for andrology. So it's good to look at those kind of, enthusing questions, which we can do. I had a patient from Kolkata who transmitted a video created on his andrological situation of a very strong Peyronie's curve. I did transmit it to Dr. Rupin and take his advice, and we did a surgery for him in the lockdown. Dr. Amol, thank you for those wonderful comments. This is the first day in the week that I have actually come out of the theater before midnight, and I'm enjoying this kind of a luminaries where I'm soaked and immersed in a wonderful kind of discussion going on. Friends, you continue to ask your question because I've been given a go ahead to continue for a short while. I must go into something very, very important right now, friends, that you practice telemedicine. Bajpayee Saab, I come to you on two important aspects. Number one is data keeping and record keeping. Bajpayee Saab, data keeping and record keeping in this era of data and AI is getting difficult. You get those cases around where somebody may not have kept 3 years of data. So the guidelines say you keep 3 years of data, and how to keep the data, or is data to be kept in all the cases, number one. Number two, a sensitive information, what we heard from our colleagues, I took cue from that. Sensitive information to be kept to yourself, to be taken it in such a way that you can keep it to yourself, you can share, you can take a second opinion or a senior's opinion on that, how tough it is on a teleconsult. Bajpayee Saab, on these two important things, data and sensitive information.
Number one, I would want to correct you, Dr. Sanjay. nowhere does the guideline say that 3 years period has been prescribed. In fact, the guidelines, if I was to point out one small shortcoming in these guidelines, it would be that they ought to have prescribed the period. Very confusing, because they say whatever period is prescribed in other laws, you follow it. Now, other law means as far as keeping data is concerned, or medical records to be precise, not data. It's different. Medical records and data are two different things. Medical records of the patient, if you have to keep, then a doctor in India currently is bound to keep data, or rather medical records only of IPD patients.
Okay.
You are not bound to keep any record of an OPD patient.
Wonderful.
And most of your teleconsultations and your teleprescriptions would be OPD. So going by that analogy, you are not bound to keep it. But again, let us not add to confusion. The maximum period that is prescribed to keep IPD record happens to be 3 years. And that is why we keep on suggesting you keep it for 3 years. It's safer. But the regulator must come up with a clear definition, description at the earliest. It's very confusing. If a doctor has not kept any records, I'll be able to defend him in a court of as good as that. Sensitive data, it is there in the data protection bill. We don't know when it will become the law of the land. Until then, why should we comment on that? Because now it is with the parliament. The parliament may amend certain provision, may add certain provisions. But yes, world over, patient information is considered as SPDI, sensitive patient data and information. So fair, you have to be very cautious how you collect it, how you store it, how you share it, how you destroy it. So it's a very, on data, yes, some protection has been given to doctors in these guidelines. And the protection is if there has been a data breach of confidentiality. And if it has happened because of some extraneous circumstances, either the platform has leaked it or some other person has to be blamed, then at least the doctor will not be blamed. This much the guideline says. But in the next breath, the guideline says that while choosing services
Be careful.
for your telemedicine consultation, you have to do due diligence. You have to be careful. So whether you are taking a cloud service, whether you are taking an app, whether you are taking a telemedicine platform, at least you should ask some preliminary question. By what about data protection? Let me know.
So, Sanjay, I just want to add this to what he said. Very rightly for 3 years. For medical legal case, 10 years. Remember that. If there is medical legal. As far as Dr. Saxena's question is concerned for andrology, I would be very worried in using an app, because what happens with the app is they store everything. And if there is a leakage, I wouldn't want my patient to suffer. I would rather bet on doing it on my telephone, even on WhatsApp is allowed, and deleting those chats or deleting those videos or whatever. So I would keep it very, very close to my chest when I do such consultation. And I would not depend on a third party for this at all, to be honest.
Yeah.
So that is what my advice to Dr. Saxena would be. That andrology is going to be very tricky, because if there is any leakage, because we get such sensitive kind of pictures coming from our patients, and the guidelines actually say that you should not be sharing those pictures. So be very careful, keep it close to your chest, and don't use any of those apps. Use something which you have faith on. Only then you go forward, is my suggestion to this.
Professor Shroff, andrology is sensitive also because many times the husband may not be able to keen to share the data with the wife.
Absolutely.
And the wife may access and ask for the data of the husband. And these are legalities which Bajpayee Saab does face.
And just to add one more thing regarding keeping the data logs. You're only expected to keep data logs of your, if you have a WhatsApp consultation, you should download and keep it in your log. E-prescription should be kept. Otherwise, video should be only kept as a record as a log that you did a video consultation. You don't have to record the video. The guidelines say that. So even with audio, you need to only take a log that you have had a discussion with the patient, and in your patient notes, right? You had a discussion with the patient on teleconsultation, and this is what you advise. So keep a log, but don't necessarily, you have to keep a recording of that. Neither video nor voice chat. Only keep a log of that. If you've seen a patient on teleconsultation, put it in your register. You saw this patient on teleconsultation. Again, that's a log. That's what we must remember. But prescriptions, yes. Prescriptions, yes. I would suggest keep all your WhatsApp chat as a backup on your desktop.
Got it. Bhagwati Sahab, there was a question why I asked you the previous question was like this. Dr. Krishnan from Madurai asked a wonderful question. I was holding it and I was trying to reincarnate into a question. It was, teleconsultation can be applied post-surgery follow-ups, or is there any instructions as per clinical condition? The reason is, a patient who underwent an open surgery and the wound is not healing well. He needs to go home now. It's getting into cost and timelines and work. So he needs to go home. From Madurai, he needs to go to Nagarcoil and needs to be on a teleconsult as a follow-up, because like Ketan did say, somebody in Jodhpur, somebody in Nagarcoil as a colleague urologist would continue seeing him as an extension. Now the issue is, he goes home on a surgery recovery. He's recovering from a surgery and is not recovered completely well. He needs dressings and all that. Do we need to keep data of such kind of consult where the extension of the treatment is still on by our colleagues in urology in a different city altogether? It happens many a times. They travel to metro, go back to two-tier cities where our colleagues and we are brothers in arms into many subjects around. So what is the data keeping required for such kind of thing, which could be a legality if the wound does not heal in future and my colleague is helping him out in Nagarcoil? Bhagwati Sahab.
See, there is one doctor who happens to be in charge of the patient at any given point in time.
Yeah.
Who would be that doctor? It will depend upon case to case, situation to situation. No hard and fast rule, A would be there, B would be there. Number one, if such a patient was being discharged, I would have written on the discharge card, you please come every week, every 15 days, and please come for a follow-up with me. I'll see the wounds and fair enough. Now, when the patient asks for a telemedicine consult, I am 200 kilometers far off, I would have asked for an email and then said, fine, you have any doctors nearby, let me have consultation with them. Okay. Now that completely protected me. Please understand, something that was in the gray zone before the telemedicine practice guidelines. Now that has been clearly regulated. Now today, on behalf of a patient, another doctor can very well speak with you on telephone. In fact, video consultation, if you want to see the wound, you can ask that other doctor. He is a qualified doctor. The patient has said, I can't come. I don't have money. I am too far off. You have genuine reasons. Patient cannot even dream of suing you. You are well protected.
Got it. Bhagwati Sahab, there's a very important question. It did not come to my mind, but now it has come from Dr. Kishore in Ludhiana. Please take this question. I've not responded for a WhatsApp message.
Just to add something, Dr. Shroff.
Yeah,
go ahead.
One thing to this, Sanjay.
Yeah.
Let's say there's an emergency. You have done a surgery. There's wound dehiscence. Wound gives way completely.
Yeah.
So this is an emergency, okay? Where you want the patient to be seen by a doctor or a hospital. So when a patient calls you, and he's your patient, because you're a primary doctor, wherever he may be in Nagarcoil or wherever. In that situation, it becomes an emergency consultation. And the guidelines tell you that all you can tell the patient is what you can do in that situation. In wound dehiscence, you can't tell the patient to do much except go to the nearest hospital or go to the nearest doctor. And that you need to record, as Mr. Vajpayee said, documentation. That needs to be recorded that a patient consulted you. This was an emergency situation. It could not be tackled on telemedicine. And I told the patient to go to the nearest hospital as soon as possible. That's what it is, should be.
Got it completely. Bhagwati Sahab, Dr. Kishore from Ludhiana asked a question, could be hypothetical, could be live and true. I've not responded for the WhatsApp message. If it comes under the medical negligence, if the patient got into an emergency because I did not respond or I could not respond, like my WhatsApp is never on alert. I see in the morning at 8 o'clock and then at 11:30 at night. So if I'm not responded to a WhatsApp consult, number one, or a message, am I liable under medical negligence? And does negligence have a different connotation now under telemedicine laws?
No, absolutely no. You are free to decide your timings.
Completely fine.
Available for telemedicine from 8 to 9. Yes, when you were discharging that patient, did you write in your discharge card that if there is an emergency, you please give a call to hospital at so and so number? If it was that critical a surgery, if the chances of a complication of an emergency were very high, that could be negligence, not picking up call, not attending a patient in a flight. You are a doctor and a call comes. See, please understand the difference between ethics and law. I am talking about law. Ethically, yes, every doctor may have his own ethical code. Any time of the day, any patient comes, I am ready. Another doctor will say, no, when I'm sleeping, no, I'm not ready. The third one may say, when I'm on vacation, I am not ready. Your ethical code, your ethics. But law says when you are there in your chambers, when you are there in your times, you have told the patient, I'll be available from 8 to 9. Fair enough. You have to be there. Otherwise, you need not bother about all these things.
Got it.
And
Now,
Dr. Sanjay has given us a very good idea also. Have a second number, put it off. Khatam ho gayi baat.
got it. Wonderful. So wonderful, actually. I'm getting soaked. So we have got some questions around while we're looking at all this. Bajpayee Saab, is there any exclusion criteria right now in the telemedicine laws? For example, the software development and software changing, the hardwares, or something like I have become from an open surgeon to a robotic surgeon. Has something come in these kind of stuff? Robotics, hardware, software changes, you are liable on all that kind of thing. Are there any criteria on these?
Yes, absolutely. See, please understand, Medical Council of India, or rather the Board of Governors of the Medical Council of India had made these laws. Any statutory body which makes law, it has a, it has to make law only on those subjects where it is empowered to make law. MCI could not have made laws for those telemedicine platforms. Probably the IT department of Government of India or some home department, any other department could have made. What they have done is that they have excluded certain aspects. Quite rightly said, software, hardware, telemedicine platforms. In fact, I can go to the extent of saying there is one clause where they say if the telemedicine platform has not checked the credentials of the doctor, and if the doctor is unqualified, we will blacklist. They don't have an authority. They can't do that. If tomorrow that telemedicine platform goes in the court of law, the court is going to blast them. Hey, how could you make law for telemedicine practice, for a telemedicine platform? You don't have the jurisdiction. So they have excluded it. Robotic surgery, quite rightly, they have excluded it. So for these, it does not mean it has become illegal. Number one, you can do robotic surgery. What is the problem is now you will be regulated by a catina of laws. 10, 20, 30, 40, God knows how many laws will be applicable. Tomorrow when a case reaches the court of law, your lawyers will apply those laws to come to a conclusion whether you were right or wrong. Similarly, patient or doctor, if either of them is not in India, these guidelines say we are not applicable. It does not mean you can't consult a patient who has gone out. But yes, if you have foreign patients, if you are not in country, you are somewhere outside, you will be governed by probably some international laws. Risk is all yours. It is not illegal. The only thing, it has not been regulated under these guidelines, probably because MCI did not have the jurisdiction to regulate as good as.
Great, good one. Professor Shroff.
Just to add one point, so well said by Mr. Bajpayee.
Yeah.
You know, the guidelines, the framework doesn't cover this. It doesn't mean you can't do it. But under this framework, you know, it doesn't cover it at all. So these are the exclusions. And the last exclusion is research. You're not allowed to use these guidelines for research. You can still do research and do tele-education or research, whatever you want to do. But this framework doesn't allow for research also.
Got it. Sorry. Ketan, can I come to you? A wonderful question from Vivek in Indore. Have a listen to this. There's a patient who pays for one teleconsult, and you do a consult and complete it. Then what happens is the patient does not come in a teleconsultation mode of a video, but what he does is he gets into multiple chat modes with you at your offline, online, vacation, and all those things around. You wanted to charge him for that. He kept on changing medication dosage, self-medication, forgetting it, coming at odd times, Saturday evening, Sunday morning. So multiple chats, multiple calls, multiple teleconsults, and he paid the fees only once. Remember that? And you are serving, you are applying a service to it. Ketan, your take on this? And then I'll come to Dr. Rajiv TP on this too.
So it happens. Means it used to happen even before the corona area also, that so many patients, once they have consulted you, they will consult you for small thing. Usually I don't charge for it, but there are patients when after 20 days or 6 weeks, if they are coming back for the consultation, in between they have asked me their small things, I don't charge. But when they come back, they do pay for the follow-up consultation charges. It is very individual thing. There are no rules for it. Basically, it depends on, like patient is having some problem with the medicine. Are you going to charge for it? Even if he comes to your hospital, you are not going to charge for it. You have given a medicine and patient is having gastritis or some unknown problems. Then either, so for those small things, you usually do not charge, previously also. And right now also, you should not charge.
Thanks, Ketan. Ketan, thanks. It was very crisp and thanks for that. Rajiv TP, sir, I'm taking a cue from this, which is a wonderful cue. Please help us out in understanding that how is Urology Society of India, like the IMA bodies and the MCI bodies, looking at supporting or maybe ensuring legal protection to our colleagues under the framework of telemedicine practice guidelines? Are you creating a telemedicine cell? Are you going to take it forward? Is there a way we will handhold and also look at the legalities, ensuring, because we've got a very strong supporter today who's loved by legal community and medical community, who's power of this impanel panel. How do we take it forward, Rajiv TP, sir? You can unmute yourself and give us a little lead on that.
Sanjay, yeah, USA is a big body. It is a legal body registered under the Societies Act with the Bombay Charity Commissioner. And we have a lot of members who are practicing in the field of urology. As I have highlighted earlier, we would like to form a telemedicine cell. And since this teleconsultation will be there in the days to come, and there will be many legal angle attached to it. So with the help of this telemedicine cell, we will be formulating certain rules and things in order to protect our members in case some legal problems occur. As far as Mr. Bajpai has said, in telemedicine, there is very little chance of a legal entanglement, but we don't know what is going to happen in future. So we will definitely have a full-fledged telemedicine cell who will look into this. And we also have a legal cell to it. Both work in tandem and help to support our members who may, for a rare phase, come into this legal entanglement. Definitely we will look into it, since we are a large body and this tele-consultation will be there in future. And there are certain people who may drag our members into some legal problems. So our telemedicine cell and the legal cell will work together to find out ways and means how to protect our members.
Thank you so much, sir. So we are running there. I'm holding you back, but because you have soaked us in the immersion of a new concept, many young colleagues have posted comments. And before I close, I will ask each of you to give your entire aspect of coming on board together. But I will take the last few questions before I tell you the final numbers of people actually there. I'm sitting between you and dinner, but it is so important that each of you came in as 4 important panelists representing different aspects today, number 1. Number 2, each of you brought us those important points which actually the live audience did ask questions around, and I think it will only snowball into more understanding. We all will go back and read the telemedicine laws better. We'll also get into the certificate course, which is handholding and strengthening and empowering us, Professor Shroff. You all will like to enroll and probably learn a little bit. while other courses do come in practice, because we need to know ourselves very well. I will take this question from your friend, Professor Shroff. Dr. Vasudevan from Kerala tells, does a teleconsult give rights to emergency support services?
No, it doesn't give rights to emergency support services within the framework, as I said again and again. The only danger is that when you get a patient, do assess the patient and make sure that this patient will benefit with telemedicine consultation. That discretion you must take, and don't do anything which is uncomfortable for you, especially when you first start. That's the only danger we have in urology, that don't start taking emergency consultations as telemedicine consultations, because you're not going to get protected by that. So as such, in one line, if you need to answer the question of Dr. Vasudevan, emergency services are not protected by telemedicine. I don't know what he means by word protected, but they are not covered in the telemedicine guidelines. It has a clause which says in emergency situation, you can give advice. Like somebody is bleeding, they say apply a 2DK and go to the nearest hospital. So those sensible things can be done, but not protection as such. I don't know what he means by protection as such, but no, emergency situation, avoid it.
Professor Shroff, Dr. Abhijit from Pune has asked a question I need to pass on to you. In telemedicine, there are technical applications which capture patient vitals, which can be accessed by the doctor remotely. Can a doctor consider these details along with telephonic discussion from patients for diagnosis and further treatment? So in other words, there could be apps which could capture and there could be telephone. There are two modes merging together as a kind of an offline shoot from the practices our friends do. Abhijit, your question from Pune.
So what I do is in our specialty, we don't have any of those things. Like, in respiratory care, you have spirometers. So you have a spirometer by which you can blow in, and the spirometer reading will go to your doctor. Then you have the ECG, which can be transmitted, by telephone. Now you have these phones on which ECG can be transmitted. Unfortunately, in our specialty, we don't have any of these kind of things available. But what I do is normally, if a patient has a previous uroflow, I ask the patient to send the uroflow picture and assess that, as such. So when he says telephone consultation, I would be more comfortable with a video consultation of a patient. When you ask for a video consultation, and then you can, speak to the patient and be comfortable. As far as, extension apps are concerned, like thermometer, ECG, spirometer, as yet we don't have anything in urology as such.
Great. The best time to sow a tree was 20 years ago when I joined you in 2000. The second best time is to sow a seed now. That means get into telemedicine now. Probably you will require it as a student when you pass out in 2021 as a urology student and become a fraternity and probably a colleague to all of us, number one. Number two, I respect all those seniors and heads of departments who have joined in from the length and breadth of the country. Look at the luminaries in terms of a practical practitioner like Dr. Ketan Shuklas and all Ketans who actually form the 5,000 group of Urology Society of India. I had the lead and the game changer for 2020 called Dr. Rajiv TP, the Secretary of the Urology Society of India, raising the academic bar to the highest possible level. I had Professor Shroff, who pioneered the very important thought process by slides, which I kept seeing in 2000, 2001. It feels good today when you smiled at Ketan and said that this is what I had envisioned 20 years ago. So I said that tree was actually sown by you. And Dr. Bajpayee, who has been known for his wonderful commanding respect on both the legal and medical fraternity. Dr. Bajpayee Sahab, you actually take a lot of good wishes and thanks for explaining in very layman's language on the issues that I could not have completed completely. I will come to a close by wrapping up my last sentences, but I will give this chance for all the luminaries to actually give their ideas on the last closing comments. Let you open your comments. Ketan, your brief comments on the program. I thank IPCA Life Sciences. You also will, that we all came together and our colleagues, our students, our teachers and our heads of departments proudly watched a show that was created so well by IPCA. Your final comments on your practice. We have got 842 people watching you live in the country.
The final comments are that, see, telemedicine is here going to stay. It's a good supplement. It is not going to be it is not going to completely replace our offline consultation practices, but it is a good supplement. There needs to be regulation and training programs, and the regulation is also going to be required. When we use it wisely, we should also know what are the limitations of the teleconsultations. We cannot apply it everywhere. And also, we should try to prevent the commercialization of the telemedicines, like people are coming out with the apps and so many doctors joining those type of consultation programs, professional consultation programs. We should be able to avoid those things also, and use this telemedicine as a tool to give a better services to our patients. Thank you.
Thanks, Ketan. Rajiv TP sir, your closing comments. Thank you for being there for 2 long hours with me and the entire team and the entire country of urologists watching you as 842 watch you live. Could you leave your closing comments on wonderful, not promises, but the upkeeps that you have done to lift us to such levels around?
Telemedicine in India was something which was not thought of a year or two later. But now, with the blessings of corona pandemic, it has come in. Government has been forced to bringing telemedicine guidelines, and it is a boom to all of you, because this teleconsultation is there to stay. It has got a lot of advantages and limitations, but we as a practicing medical fraternity should be very tactful in handling it. We should utilize it in an appropriate manner, that as Ketan has said, we should be wise in utilizing it. We should have limitations for using, and the one very important thing is that there should not be commercialization of this teleconsultation, because what I foresee in the future is that there will be a big marketing on this telecommunication, and the people will try to commercialize it. Then the glamour of telemedicine will go on. Telemedicine is a thing which should be used for an immediate purpose, wherein a patient from a distance cannot come to a doctor at the same moment. At the same time, a doctor can give his opinion for the time being and tide over the crisis and call him later. And this has got its own advantages. For example, as Dr. Shroff has said, in an emergency, somebody has said in an emergency, you can give the emergency prescription, but patient has to come on. So it should be used wisely. One should know the limitations of it. One should avoid commercialization of it. But whatever said and done, this is there to stay, and one should use it in a very appropriate manner.
Thank you, Rajiv TV, sir. We heard from the legal luminary who actually brought it extraordinary ability to bring it absolutely threadbare on what telemedicine consult means and what the law is in black and white. He did consider the factors before you do a telemedicine, which is about the context of telemedicine, identity disclosures, the mode of communication that you and I will choose, looking at the consent, very important, which could be an implicit consent, an explicit consent, the type of consultation that you and I will choose, and we have our own ability on that, evaluate a patient and do a patient management. Mahendra Bajpayee Sahab, you have been known to be a very strong and forceful argumentation in favor of all of us all the time. Today that you laid the subject so threadbare, can we hear your closing comments as the country watches you live?
Dr. Pandey, number one, I am not a doctor, I am a poor advocate.
Yeah, go ahead. You're a doctor of your subject.
To me as a doctor. Okay. Number two, I distinctly remember I was unable to drive my car or drive a car in my driving school. And my instructor told me one day, "Arey bhai, you have brake na? If you are in trouble, just push the brake, stop, finish. Nothing will happen. The ones who are on the right lane, they will go away." And that gave me immense confidence. Same thing is applicable here. Dear doctor friends, please resort to telemedicine. Come on that. Any point of time, law has given you that liberty. Stop. You are not comfortable, stop. But this is a gift of technology, modern technology. Use it for your benefit, for the benefit of the patient. And not only in this pandemic, even after that. And one more thing, I would want to thank Dr. Shroff from this platform for the wonderful all that he is doing in organ transplant, organ donation, issue very close to my heart. Thank you, Dr. Sanjay.
Thank you from the Doctor of Law. Thank you, Bajpai Saab. It was great to have you here. You were a guest, and I think we all reveled in understanding the subject. Interestingly, threadbare for practical use. You enthuse a lot of young urologists who will tomorrow be our fraternity colleagues. While that wonderful trophy, which was gifted last week from the Kaun Banega Crorepati, to actually take the subject to the society, which is what you opened up, Dr. Shroff, in the last 2 decades that I have known the work. You also did initiate today the flow of the whole subject as to how you do it. Initiating, identifying, taking the consent issue, looking at the information exchange, and those important sensitive data and information, patient evaluation, patient management, emergency services, down to the way to Dr. Vasudevan in Kerala. I salute you for having been here today and helped us out in this important drive today. Professor Shroff, your final comments today before we close the program.
Thank you, Sanjay. And Bajpai ji, thank you so much for the support you have given us on organ donation and transplantation, because I must say to all the audience that Bajpai ji has organized many sessions where we have worked together towards the law, what changes are required in the law as we go forward. So Bajpai ji, always a pleasure to have you on any panel and always a pleasure to interact with you. In my closing comments, I would only say that we are in the new normal, and this new normal, telemedicine is here to stay. On 15th of August, Prime Minister Narendra Modi ji talked about the health ID card, just like your Aadhaar card, which is going to have all the information captured in that. The Ayushman Bharat is here to stay. We have such a 600,000 villages in this country, which are not kind of connected to the cities. There are so telemedicine as a specialty, as a subject, is going to be here to stay. My only request to all my colleagues is practice safe telemedicine, practice ethical telemedicine. As Rajiv said, don't make it too commercial, because we must talk about affordable healthcare in India. And telemedicine gives us an opportunity for the affordable universal healthcare, which is a dream for our country, for so long. We've been talking about this universal healthcare forever. Universal healthcare in 2000, universal healthcare in 2010, universal healthcare in 2020. Telemedicine as a technology is going to make it happen. So affordable healthcare in India, we are fantastic. We are actually a jugaad country because we can do amazing things with very little resources. 33 years back, I always say this, our first communication satellite was loaded on a bullock cart. And today, we have, 33 years later, the Mangalayan, the cost of the Mangalayan, was less than a cost of 1 kilometer of auto rickshaw ride, less than 7 rupees a kilometer was the cost. So in India, we can do amazing things with very little resources. So we have an opportunity to change the whole healthcare ecosystem, not only of India, but many developing countries in the world. America is not going to do, USA is not going to do, Europe is not going to do, we can do it as a country. So we had an opportunity with this technology. And in the end, I would say to all my young urologist colleagues, and of course, my friends and my senior colleagues as well, if you please familiar with the guidelines, take a course with Telemedicine Society of India. We offer a course, 2 hours of lectures just like this, and interaction, and 2 hours of study material we give along with the test. Once you do that, you will be very safe in practicing telemedicine in the country. So thank you very much, and good night to everybody.
So before we close, let me speak my final words from the heart. Professor Shroff, yours was always a futuristic view, which actually put us back on the saddle. As futuristic as my childhood days when I used to see Feroz Khan movies, which was always futuristic and ahead of times, like the Dharmatmas and Janbaz and Qurbanis. I'm actually enjoying this completely, and I have been soaked in the glory of so many people sending such good messages about the kind of work that you have done and the kind of hand-holding today Advocate Mahinder Bajpai has done to thrash the subject open. While we go back and read the telemedicine laws and we get into this 2 hours course, understand and polish us better. Ketan Shukla actually was the epitome of practicing it both online, offline, bringing us together. So we had all examples. I think we had got wonderful kind of leads today. 9:15 is the time where ladies have said the dinner is being served on table. I would actually take a break, thanking IPCA Life Sciences and taking those wonderful kind of comments you have put in forward. This always happens to be possibly the first urological telemedicine program, and many will usher in due course of time. IPCA, thank you for creating a platform. thank you for spreading it worldwide, because the kind of questions which came, and many of them which I could not have taken in the framework of time. I thank luminaries, 4 of them as giants here, and many teachers, colleagues, friends, and urologists in making who have taken this challenge to come on a Friday evening. Have a great weekend. Have a great show. Continue discussing with all of them. We bring it to a close. IPCA, thank you so much, Professor Shroff, Ketan Shukla Saab, Rajiv TP Saab, and Mahinder Vajpayee Saab. Thank you again. We bring it to a close. Good day and good evening.
Sanjay. Thank you, sir. Thanks.
Thank you. Thank you, everybody.
Very much.
Thank you. We can leave now. Bye-bye.